Representative
told earlier
Albright.
today that I have to speak coherently and directly into the microphone, so I'm just trying to make sure that I do my job as best I can.
You just do your best. Representative Albright moves HF 743 to be laid over for possible inclusion in the Health and Human Services Omnibus Bill. We have the bill before us.
And Mr. Chair, I do have two amendments which I would prefer to take in their order, put the bill in the shape that I would prefer it.
All right, Representative Albright moves the A2 amendment. Representative Albright, to your amendment.
Mr. Chair and members, the A2 amendment specifically just talks about a change in the language to further define the difference between the gradients of or levels of education incumbent upon this bill.
Any discussion to the amendment? Seeing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion prevails.
And Mr. Chair, I'd move the A3 amendment.
Representative Albright moves the A3 amendment.
And
Representative Albright, to your amendment.
Mr. Chair and members, what this does is includes eligible dental therapy programs. It's become known to me the import of this through the course of working on this bill, and we're including that in the bill, as well as changing lines 1 on line 5 and 15 of page 2 to change that for pharmacists as well as advanced dental therapists.
All right, Representative Albright. Any discussion, members? All right, seeing none. All those in favor say aye.
Aye.
Opposed? Motion prevails. Representative Albright, to your bill as amended.
Thank you, Mr. Chair and members. I will be brief. What this bill does, House File 743, is established as a grant program for eligible healthcare professional sites, commonly referred to as clinical training sites. With the amendments that we have just adjoined to the bill, it makes it more robust and comprehensive for the purposes of the dentistry industry, as well as making some technical changes to the language. Minnesota healthcare workforce shortages have been well documented in previous presentations to this committee as well as others. The Legislative Healthcare Workforce Commission report in 2015 identified workforce shortages and presented solutions, which you supported by expanding physician residency and loan forgiveness opportunities. Clinical sites and related training are essential to train the Minnesota healthcare workforce. That is without a question. Clinical hours are a requirement for licensing and provide real-life experiences in patient care under the supervision of a licensed professional. House File 743 creates a grant program to expand clinical training facilities and sites for physician assistants, advanced practice registered nurses, mental health professionals, and now, as amended, the dental profession. The Workforce Commission received testimony from both students and training institutions and learned to a great degree of the challenges in providing the training sites needed to develop the skills required to begin practice. This lack of clinical training sites has led to a delay in graduation for some students. Minnesota needs a strong healthcare workforce. The grant opportunities in this bill will begin to address the need for additional clinical sites by providing support to the 10 to 15 programs each year. I have testifiers in the audience that are able to answer questions on the technical nature of this bill, if so desired, Mr. Chair, but I will leave my comments at that and be available for questions.
Is there anyone in the audience who would like to testify on this bill? All right. Seeing none, members, if you have any questions?
I think he was correct.
Any final comments, Representative? Seeing none.
First, a few words.
Oh, thank you for bailing me out, Representative. Representative Haley, you have a question.
Thank you, Chair, and thank you for your testimony and your bill. I'm curious, just because I don't have, when you say clinical sites, is this additional programs at our universities, or this is where they're actually doing their their practice work. So we're providing money to the actual healthcare institution where they're doing their practice work. Can you clarify?
Representative Albright.
Mr. Chair and Representative Howley, this is actually at the site where they are practicing their trade and craft and perfecting their craft.
Representative, follow-up question?
Yeah, I'll let it go.
All right. Any other questions? All right. Seeing none, HF 743 as amended is laid over for possible inclusion in the Health and Human Services Omnibus Bill.